Hi everyone, I am Dr.Saritha Prem, Director of 𝓮𝓁𝓼 Hospital. So here I am again with a new topic, dysmenorrhea. It is a very common condition which women is facing lot of difficulties during their menstrual cycle. So before coming to the topic dysmenorrhea, I want to say something about menstrual cycle or menses or periods, whatever we call. Every month in an adult woman, especially after the age of between the age of 11 and 14, they achieve their menarche, and from that time to the menopausal time, that is usually 50 to 51 years of age, each and every month women bleed in a particular days. So it is a main preparation. So the uterus is getting prepared every month for the process of conception. The uterus is getting prepared for the pregnancy. So when that pregnancy is not achieved in a month, definitely that lining, that is endometrial lining, which is newly formed, along with the blood from the blood vessels, and also the unfertilized egg shreds and starts to bleed. So that is called as menses or periods. So it's a common in each and every woman. So from the starting, it's from the menarche to the menopausal age. So this time when there is severe cramps, that is painful menstruation, we call it as dysmenorrhea. So the word itself denotes, it's a Greek word. So from that word itself we can know that this means difficulty, painful, such meanings it have, the word dys. So when in any medical term, when you see the word dys, you must understand it is denoting some difficulty or some pain. We say dysmenorrhea, dysphagia, a lot of words are coming in medical science. So dysmenorrhea is painful menstrual cycle. So here there will be severe cramps during the bleeding phase. It is due to the contraction of uterus, and so dysmenorrhea we can be it is mainly of two main types, that is primary and secondary dysmenorrhea. Before coming to that, I want to say what are the causes of dysmenorrhea. We can't say an underlying causes, typically this is a cause of dysmenorrhea, because it can happen throughout the life in many women without any specific reason. So mainly some cramps are usually happening there due to the contraction of uterus. So the uterus contract to push out these blood and the underlying linings and also the unfertilized egg to the bleeding stream. So this is the reason that time there will be a mild cramps in every woman. So when it is more severe, it leads to, can be due to any other underlying cause also. Some of the common cause of dysmenorrhea, we can say the improper diet habit and activities of girls that they follow during this time, and also some of the underlying diseases can lead to dysmenorrhea, like endometriosis, adenomyosis, uterine fibroid, endometrial polyp, and some of the sudden causes are due to any miscarriage or ectopic pregnancy. So these are some of the causes. And in women who is having the habit of excess consumption of alcohol, smoking, they are also very prone to get this condition, that is dysmenorrhea. We can't say dysmenorrhea as a disease, it is just a symptom that we can see during this time, during the menstrual cycle, or due to any other underlying diseases. So these are the common causes. And the symptoms that develop during this time, that is symptoms of dysmenorrhea, is excess abdominal cramps during the period cycle, and also severe lower backache, nausea, vomiting, headache, and severe gastric disturbances, weakness, fainting, tiredness. Everything is very common during this time, common symptoms which we can see in girls during this period. And the next main important thing which I want to say is dysmenorrhea is mainly of two types, primary and secondary dysmenorrhea. Primary dysmenorrhea occurs from the first day of periods throughout the life. It can occur. It can be due to the abnormal contraction of uterus. So one of the main reason for this abdominal contraction can be the imbalance of the chemical, that is prostaglandins, during this period time. Secondary dysmenorrhea can be due to any underlying diseases. The severe abdominal cramps due to any conditions like endometriosis. It is also one of the abnormal growth of endometrium. Here we can see the endometrial lining growth outside the uterus also. And next one is adenomyosis. It is also another abnormality which happens in the uterus, that is in the tissues itself. And the other thing is uterine fibroids. Fibroids, when I used to say that fibroids, mainly there is two types, symptomatic and asymptomatic fibroids. In symptomatic fibroids, we can see the woman who is having fibroids, intramural fibroids, all they will be having severe abdominal cramps and bleeding during their menstrual cycle. And another thing is endometrial polyp, small polyps, if we can see in the endometrial lining, during that time also they will be having severe abdominal cramps. And there are some sudden onset of dysmenorrhea, that those reasons can be due to ectopic pregnancy, that is tubal pregnancy, sudden miscarriage. This all things can lead to the dysmenorrhea. And even in pelvic inflammatory disease, we can see dysmenorrhea is a common symptom. So these are some of the main reasons, or in the different types, that is the primary and secondary dysmenorrhea. The other thing is that how can we investigate this condition? So in order to find whether there is any underlying condition or disease for a triggering factor for this dysmenorrhea, we can do a normal USG, and as ultrasound scan, MRI, and also hysteroscope, and a lot of this type of investigation we can follow in order to check whether there is any peculiar reason for this pain. The other thing is how to mainly correlate it with, that is what is the concept in Ayurveda for this dysmenorrhea. In Ayurveda we call it as 𝓂𝓵𝓪𝓻𝓼. It is mainly due to the vitiation of Vata. All the gynecological disorders happens only when there is excess vitiation of Vata dosha, any abnormality in Vata dosha. Already in my all videos I used to say the three doshas, that is Vata, Pitta, Kapha, the normalcy is very essential for our health. So when there is abnormality or abnormal levels of these doshas, it leads to many diseases. So here also Vata, especially the Apana Vata Vikruti, is one of the main reason. It can be due to the mithyahara, that is improper diet, due to excess exertion of body, due to improper activities, all can lead to this Apana Vayu Vikruti. So when this Apana Vayu is getting vitiated, it is having the main prominence will be Vata, but the Kapha and Pitta will be the Anubandha doshas here. So the lady will be having more symptoms of three doshas. Here during the time of our menstrual cycle, gastric disturbance is one of the common symptoms which many girls face. So that time we have to be very cautious in what we are following, especially in our diet, in our activities, in our medicines what we are using and all. So according to the Ayurvedic science, here the treatment principles start with, first we have to make the Vata dosha in a normal state. So in order to make Vata dosha in a normalcy, the main drugs which is used to bring down, so bring back the Vata to normalcy, we administer. Especially Vata drugs we use to administer, especially some treatment methods like Vasti, Uttaravasti and Matravasti, Snehavasti, oil enemas we use to administer during this time in order to bring down the vitiated Vata dosha. And also some external application of oils like castor oil, a little lukewarm castor oil, Karpuradi oil externally in the lower abdomen can give a better result in relieving the cramps during this period, in order to give them a smooth, the muscles will be having a normal contracting, pain will be coming down during this time. And also we can follow the main some internal medicines, especially the water which is boiled with fennel seeds are very useful to reduce the pain during the menstrual cycle. Any 1 tablespoon of fennel seed you can boil in 1 liter water, and you can drink it intermediately in a lukewarm form in between, so that it reduces the cramps. And the other method is fenugreek, which is having a decoction prepared in fenugreek or gingerly. It's very good to reduce the cramp during this time. And also you can have 1 spoon of aloe vera juice with 1 spoon of honey in order to reduce the pain during the periods. So these are some of the easy methods which we can follow in home. And there are a lot of beneficial Ayurvedic medicines which are very useful during this time, especially like 𝓂𝓮𝓪𝓻𝓼, 𝓂𝓗𝓪𝓻𝓼, and also some of the specific preparations like 𝔂𝓗𝓪𝓻𝓼, all to reduce the pain and cramps during this time. 𝓮𝓁𝓹𝓮𝓻𝓲𝓮, all beneficial, but we can't take anything that in blindly during this time. You have to take the proper advice of an Ayurvedic physician before taking the Ayurvedic medicines for dysmenorrhea. If you having any underlying causes, as if I told you before, like endometriosis or any other causes like fibroids, you have to be in a proper stream. You have to take the medicines for those conditions, then only you can control this dysmenorrhea. So you have to take the guidance of an Ayurvedic doctor before taking the Ayurvedic medicines for dysmenorrhea. And now I want to say it's very important is diet. Diet play a very good role in a normal cycle, to bring our cycle in a normal pattern and to reduce these cramps. You have to take lot of leafy vegetables, which is very essential and which is very rich in vitamin E. You have to take a lot of nuts, especially almonds are very beneficial during this time because it is rich in vitamin E. So it reduces that contracting pain a little. So you can have almonds, and also take lot of pulses and fruits, especially plums, berries, and also avocados you can have, because it all have the action of controlling this cramp, because they all are vitamin C rich and they are rich in antioxidants. So it is very beneficial during this time. Drink plenty of water. Keeping you hydrated is very important, because when you keep yourself hydrated, you can, to an extent, you can bring down this symptoms more. And also mainly concentrate your diet, that is, take some light diet during your menstrual cycle. Don't take anything heavy. Don't take junk foods, especially deep fried oily foods. Don't take more added sweets and all. You have to be very cautious. Don't take more cold chilled food items, cold or chilled food items, because some people used to say that in order to control the pain I used to have an ice cream. No, don't take such food items. Try to take foods that is very easily digestible, and don't be in fasting also, because already there will be gastric disturbance. So if you are not taking the food proper time, it increases. So don't be in fasting. You can use some hot water bags in order to reduce the cramps. And also before I told you to apply castor oil or karpuradi oil. After the application of oil also, you can give a small hot fomentation in the lower abdomen in order to control the pain. And also women, if you are having the habit of intaking alcohol or smoking anything, please try to avoid it, because alcohol tends to increase the pain during the menses. So if you are having the habit of taking alcohol during the cycle, please try to avoid it. It is very dangerous and it gives us severe cramps during that menstrual cycle. And also do regular exercise. That is very important, because some of the risk categories in dysmenorrhea is those who are taking more alcohol, those who are smoking, and also overweight. Those categories we consider as a risk in dysmenorrhea. So risk factors, in order to avoid these factors, you have to be very cautious in whatever things, whatever activities you are following daily. Do daily exercises. You can follow yoga. Yoga is very beneficial during this time, because you can, in yoga mainly the Vajrasana, Gomukhasana and Uttanasana, all are very beneficial to reduce the abdominal cramps during your menstrual cycle. So these are the important points which I want to say you about dysmenorrhea. So if you feel it is very beneficial for you, please share to your friends, or to maximum to everyone, and also subscribe our channel if you are not yet subscribed. And also you can join through the WhatsApp link, and you can join to our hospital group in order to if you have any queries, you can ask personally in our numbers, so that we will definitely clarify it. And please post your comments, so that if you have any doubt also, you can post in the comment box. So definitely I will reply you for your comments. So next time we'll meet with a new video.